How did Nazi medical experiments violate medical ethics? Have you ever wondered how medical practices can go horribly wrong? The Nazi medical experiments during the Holocaust serve as a chilling example of this. These experiments were not only inhumane but also violated the very principles of medical ethics. Let's break down how these violations occurred and the impact they had on countless lives. First and foremost, the most glaring violation was the complete absence of consent. Victims, often prisoners in concentration camps, were subjected to experiments without any agreement. Medical ethics demand that individuals must voluntarily agree to participate in research after being fully informed about the procedures. In stark contrast, victims were coerced, facing threats of death or further suffering if they refused. Next, consider the extreme pain and suffering inflicted during these experiments. The intent behind these tests was not to help the victims but to further Nazi ideology and military goals. For instance, prisoners were exposed to freezing temperatures to study hypothermia. Others were deliberately infected with diseases or subjected to sterilization procedures aimed at racial purification. These actions caused severe physical and psychological harm, often leading to lasting injuries or death. Additionally, the principle of beneficence was grossly violated. Medical professionals are ethically obligated to act in the best interest of their patients. However, the Nazi experiments were intentionally harmful, lacking any therapeutic purpose. Many victims were left permanently disabled or died as a direct result of these cruel practices. Moreover, the experiments reflected a blatant disregard for justice. The subjects were selected based on their status as prisoners, Jews, Roma, disabled individuals, and other marginalized groups. This selection was rooted in racial and political discrimination, rather than any scientific or humanitarian concern. The experiments were part of a broader system of oppression and extermination. Following World War II, the extent of these ethical violations was brought to light during the doctor's trial. Leading Nazi physicians were prosecuted for war crimes and crimes against humanity. This trial highlighted the need for ethical standards in medical research, leading to the creation of the Nuremberg Code. This code established essential principles, including the necessity of voluntary consent and the obligation to avoid unnecessary suffering. In the context of Holocaust history, these medical experiments stand as a stark reminder of how medicine can be misused to serve oppressive ideologies. They illustrate the dire consequences when ethical standards are abandoned, reducing human beings to mere subjects for experimentation. Understanding these violations is vital for honoring the victims and ensuring that medical research today respects human rights and dignity. By learning from the past, we can work towards preventing such atrocities from ever happening again.